The family dog has become a staple in American ideology. In fact, according to an APPA study in 2019, 67% of American families own some sort of pet. That means that statistically, most of you here today own or have owned some animal at least once in your life. And of course, with pet ownership comes visits to the vet clinic. Now, many people view their veterinarian as someone they go to just once or twice a year for those really simple, easy, regular checkups and vaccines, maybe dental work, stuff like that. However, many people do not realize the long and hard road it takes to become a certified veterinarian. So hi, I'm Maya Nix. Ever since I was 3 years old, I wanted to become a veterinarian, and today I will be telling you all what exactly animal medicine is, how to become a veterinarian, and the specialty that I myself would like to go into. So first off, what is veterinary science? Well, according to Kramer 2018, it's the branch of medicine that deals with the prevention, diagnosis, and treatment of disease, as well as disease prevention in animals of all types, from family pets to farm livestock and zoo animals. Boiled down, it's just the career field that deals with treating animals whenever they are sick or injured, as well as researching and using different preventatives and treatments for different diseases, sicknesses, and ailments in animals. So there are many fields of animal medicine. However, the two biggest ones that we will talk about today are the small animal and large animal fields. Small animals, as the name implies, they work with the small animals and the pets. So these would be dogs, cats, pet birds, pet reptiles, other small mammals. If you have any of these animals, you would go to the small animal vet. Now, they have a physical location called a clinic, and that means that they have a very regular schedule. So the clinic might only be open from, 9 to 5 or 8:30 to 5, leading to very nice, regularly scheduled hours of operation. Now, there is a huge amount of small animals in the United States. In fact, according to Kramer 2019, 66% of vets in the US focus and specialize solely in small animal medicine. That's huge considering how many fields of animal medicine there are. And with that huge number comes a pretty nice salary. At $90,000 a year, small animal vets make way more than many other fields of animal medicine. On the other side, we have the large animal vets. Now, they work with the livestock and food animals. These would be your cows, your sheep, your goats, anything like that. They're usually mobile, which means their entire clinic is packed into 1 or 2 vehicles, and they will travel from farm to farm making their visits and treating the animal at its home. Because of this, they spend a lot of time on the road and they have pretty irregular schedules. We have a huge shortage of large animal vets in the United States, especially in those really remote areas and rural areas where they are needed most. This could be because large animal vets are in significantly more danger by working with these animals. They also have that really irregular and sometimes just awful to work with schedule. And they only make $53,000 a year, which is really on the low end of salaries in animal medicine. So now that you know a couple fields of animal medicine, how exactly do you become a veterinarian? Well, there's really 2 main components. There's education and extracurriculars. Education is, of course, required for all vets. This is how you become certified and learn what you need to know. It's actually not unique to the different specialties and professions. In fact, all veterinarians go through the same exact schooling up until about the end of veterinary school, which is when they split off into their different specialties. Furthermore, you also need extracurriculars to become a vet. While these aren't exactly required, they're hugely greatly recommended, especially as resume builders for getting into a good veterinary school. Now, any extracurricular would include any activity that gives you hands-on experience with animals. So these could be internships with vets and zoos, volunteering at your animal shelters, and clubs and organizations such as 4-H. So let's delve a little bit more into the educational course to animal medicine, and it is a long one that starts all the way back in high school. So in high school, the person should really focus on getting good grades, especially in those math and science classes. This is also where they can begin to build the foundation for their resume with experience, hands-on animal experience, with those extracurriculars that I mentioned previously. Now, any extracurricular that started in high school will look really great on your graduate school application and even on postgrad because it shows that you have a lot of experience with animals. After high school, you move on to your undergrad, where you need to complete a list of required classes for your graduate school. These will all be very science-based, so this will be your biology, your chemistry, anatomy is another big one, as well as genetics. They differ from graduate school to graduate school, however, most of the core ones are the same. After obtaining your bachelor's and completing those classes at the undergraduate school, you move on to your graduate school. Now, this will last 4 years. The first 2 will be structured very similar to undergraduate school, just specialized in veterinary medicine. So there'll be a lot of in-class and in-lab learning, not much real life or real animals are involved. The last 2 years will begin the transition to real life and real animals, so they will start doing clinical rotations, job shadowing, and eventually perform their own surgeries. At the end of grad school, you need to pass the NAVLE exam to obtain your DVM, which is your Doctorate of Veterinary Medicine. After graduate school, there are really 2 options. You can either immediately join the workforce as a practicing veterinarian. However, many people actually decide to complete residencies and internships, as this not only cements their knowledge that they have right now, it also furthers their career as they can get certified in different specialties such as surgery. Now, talking about specialties, my specialized interest is equine medicine, which is just a fancy way of saying horse vet. Now, horse vets are a subcategory of livestock vets. However, they typically do not work on any other type of livestock animals, such as cows, sheep, goats, anything like that. Many will actually offer both mobile and clinic-based services. Mobile services will be for those really quick checkups, vaccines, dental work, anything like that. Whereas the clinic just provides a location if the horse does need surgery or just a large operation or observation in a very controlled environment. There's a huge demand for equine specialists in the United States, as only 5.7% of vets are equine vets compared to the 66% of vets that specialize in small animals. That number is tiny, and we really need more equine vets in the United States. So today I talked about what exactly veterinary medicine is, how to become a veterinarian, and the specialty that I would like to go into. Next time you go to your vet, please just take the time to appreciate all of the hard work and dedication that they have put in to becoming a certified veterinarian, because that road is not short, nor is it easy. However, without these dedicated individuals, we would not be able to care and provide for the animals that we do today. Thank you.